we have a forensic medicine lecture on electrical engineering. And for this, I take very much pride in introducing
I'm sorry, I think there is a network issue with Parthiban. So, good evening, everyone. I welcome each and every one of you for this wonderful session for today. So, today we are going to have a wonderful session on electrical injuries by Dr. Veera Vijayan, sir, Senior Resident, Department of Forensic Medicine from Kallakurichi Government Medical College. Welcome you, sir. So, we are going to have a fantastic session, that too for the exam going batch. So, kindly make use of it. And I request now, sir, to start the session.
Okay. Good evening, one and all. And thank you for this opportunity on medicine. Today, I am going to discuss about electrical injuries. Before moving into the topic proper, let's discuss something about basics of electricity. What is electricity or current? Current is nothing but it is the transfer of electrons from one electrode to another electrode. What is voltage? Voltage is the potential difference between the two electrodes so that the electrons move from one end to another end. Then resistance is the impedance or obstruction that is caused to the flow of electricity. This resistance decides the flow. Then another one important aspect is AC and DC current. AC current is nothing but it changes its direction in particular frequency. DC current is it flows in the same direction. AC current flows in the same direction. Sorry, DC current flows in the same direction. AC current changes its direction in particular frequency. Then we have to know some source of electricity. That is, we can classify these sources as domestic, that which we are using in our household appliances. That is usually between 220 to 240 volt. Industrial current, it includes industrial commercial purpose, which is usually more than 500, but 500 volts. Lightning, the voltage will be in thousands or in millions. So another one important thing is in household, we are using AC current. DC current is usually used in batteries, and in medicals we use it in defib and some appliances in OT. Then we have to know about Ohm's law and Joule's law. Ohm's law is nothing but V is equal to IR, where V is the voltage, I is the current, and R is the resistance. The unit of voltage is volt. Current, the unit of current is ampere. Then resistance, unit of resistance is ohms. So Ohm's law states that V is equal to IR. That means voltage is directly proportional to the current and resistance. Another one is Joule's law. Joule's law formulates that Q is equal to I square RT, where Q is amount of heat produced. I is equal to current, as we already saw. R is equal to resistance, and T means time. I will explain in the latter part why this Ohm's law and Joule's law are important to study about electrical injuries. Then coming into the definitions, electrical injuries are nothing but the injuries that is caused in a human body due to the flow of electricity. That is electrical injuries. That term electrocution can be used if death happens due to the electricity. Then moving into the mechanism, what are the effects of current that is caused in a human body? There are mainly two effects. One is cellular depolarization. Every cell in our human body acts on the principle of action potential. Current disturb this action potential. Another one mechanism is current is converted into heat energy in our body. That heat produces damage to the human tissue. That is another. These two are important mechanism by which the current causes its damage in the human body. Then moving into the clinical features, usually if you touch a wire with the low intensity or low voltage, most of us would have felt this, the tingling and numbness sensation. This is the first symptom to appear. Then if we prolong the contact with a wire, it leads to pain. These are the commonest symptoms in low voltage currents. Then if we prolong the contact little more, skin lesions are produced, that is burns. We will discuss in the later part. Then what are the effects in the eye that is caused by the electricity? Usually this electricity causes anything in our body, from this tingling to death. In the eye particularly, it causes corneal edema to blindness. In between, it may cause choroiditis, retinitis, sometimes cataract in late stages. These are some of the effects of electricity in an eye. Then CNS effects. In CNS, it may cause aphasia, paraplegia or hemiplegia, sometimes amnesia, even coma. These are the effects of electricity in CNS. Then cardiac and respiratory system. In cardiac system, it mostly causes arrhythmias. In respiratory system, it will cause respiratory arrest or asphyxia. I will explain in the further slides. First, we will see one by one. The particularly important thing in electricity is skin lesions. There are two types of skin lesions. One is endogenous burn, another one is exogenous burn. Before seeing this, first we have to know some terms regarding electricity. That is, electricity, this is one point, this is one point. Electricity flows from one point to another point. This is electrical current, or usually they call this as electrical circuit. If any human tissue or body comes into contact in this circuit, it produces burns. That's the common principle. Apart from this electrical circuit, sometimes what happens is it is a wire. This is a wire, but without contact, without producing circuit, this electron sometimes flow from one to another end without any contact. That we call it as arc, electrical arc. Another one is spark. Spark is nothing but here, see this picture. This is one point, another one point. This is the electrical circuit, this white line. This current is flowing in this circuit. Apart
Hello, sir.
Sir, I think, sir, network problem and health text.
Kindly just hold on, sir. Will be back after
Hello.
Yes, sir. Now you're audible.
Is it
Kindly.
audible now? Sorry, sir.
Yes, sir.
Here,
You're audible.
power
Kindly
issue.
Yes, sir. I'll just make. You are just co-host. You can just share the.
What happened? We lost him again, huh?
Yes, I guess. Try calling him.
Hello.
Yes, sir. I'll just make you a host. Kindly share your screen, sir.
Now I have shared this.
Yeah.
Sorry, like power of ears. That's why it's used. May I continue, sir?
Yes, sir. Sure. You can continue, sir. You can just share your screen and continue, sir.
Okay, sir. Right, my screen is visible now.
Yes, sir. Your screen is visible, sir.
Okay.
Yes, sir.
Sorry, guys. Power failure here. I continue. Here, this electricity flow apart from this electrical circuit for some distance. Say, for example, some 1000-volt current can move up to 30 to 35 centimeter away from this current. This is known as electrical spark. Sometimes due to electricity, our body or the dresses or clothes what the victim wear gets ignited and it burns. That is known as flame. So we have to understand here that what is electrical circuit, electrical arc, spark, and flame. Flame is nothing but the burns that is due to the ignition of combustible materials such as cloths. That is flame. Spark or without contact, the electrons will move from one electrode to another. That is electrical arc. Circuit is the normal thing. Now, comes to the skin lesion, the burns are two types. One is endogenous and exogenous burn. The main difference between endogenous and exogenous burns is that here in endogenous burns, the heat is produced inside the body. That is, a person touches a live wire. Here the heat is transferred to the body of the individual. There, the heat will denature the protein. Here, heat is produced inside the body. That is the first point. Then this heat denatures the protein and it liquefies it. After liquefaction, this liquid will boil and ruptures. When it ruptures, it produces burns. That burn is known as Joule's burn or crater. I will explain what is crater in the later slide. Then moving to the exogenous burn, here heat is produced outside the body. Then there is no contact with the live wire. So here the two difference between endogenous and exogenous burns are, in endogenous, endo means inside, heat is produced inside the body. Exo means outside. Here heat is produced outside the body. Another one thing is, here there is no contact with the live wire in exogenous. In endogenous, there will be some contact. These endogenous burns are otherwise known as Joule's burn. There are varieties of Joule's burn are there. That varieties are, one is crater, broken blisters, splits or lacerations. In the end, it will get charred. These are just the names for Joule's burn, depending on the appearance. See, this is crater. Crater is a type of Joule burn, which is a endogenous burn. Here, it is mostly circular or oval in shape with a damaged skin. Surrounding, there will be raised edges or rolled out margins. I have said that the liquefied tissue will rupture. That rupture will produce a rolled out margin here. This is normal appearance of a crater. Sometimes there will be blanching of skin around this crater surrounded by a hyperemia. These are usually rare. This is one type of Joule's burn where the skin is lacerated. Here, see, this is lacerated skin. We can say it as splits. Then sometimes this Joule's burn will take the shape of the conductor. Here, electric wire. This is the Joule's burn. So Joule's burn may be a crater, broken blister, or splits or charring. In exogenous burns are otherwise known as splash or spark burn. Now you would have understood what is spark or flash. Here there is no contact. This is human tissue. This is electric wire. As such, there is no contact, but the spark from this electricity causes damage to the skin. This is the spark from this live wire. This is flash or spark burn. See, this flash or spark will produce multiple punctate areas. This heat will liquefy the keratin. Upon cooling, this liquefied keratin will solidify and produces punched out lesions in varying sizes. This is an example of exogenous spark burn. You see here also multiple discrete lesions. This appearance more or less resembles that of a skin of crocodile. So these exogenous burns are otherwise known as crocodile spark burns. This is about the skin lesions. Clear? Then we have to know some factors which decides the severity of these injuries. For this, we have to know that Ohm's law and Joule's law. Ohm's law is V is equal to IR. Joule's law, Q is heat that is produced equal to I square RT. After substituting this value, we can remember these factors. One is voltage. If voltage increases, severity of the injury increases. Another one is current strength. If current strength is more, then the amount of heat produced will be more, then the severity of injury will be more. Current strength is directly proportional. With this current strength, there are certain points to remember for your MCQs. That is, 1 milliampere of current will cause tingling, or sometimes it is not perceived by the individual. So it won't produces any effect. Then 3 to 5 milliampere current will produce let go effect in children. This let go effect means after touching the current, we can voluntarily release the wire. That is let go effect. 3 to 5 for children, 6 to 9 for adult. This let go effect. 16 milliampere is the maximum current a person can grasp and let go. After this, if the person recognizes he touched the electric wire and wants to release, but it is not possible him to release the live wire because of these tetanic contractions. Once the tetanic contraction sets, there won't be any let go effect. So the maximum current which a person can release from his contact is 16 milliampere. Then in 20 to 50 milliampere, it causes paralysis of respiratory center. During 50 to 100 milliampere, it causes ventricular fibrillations. The easy thing to remember is 1 milliampere, just tingling or no sense. Again, 10 milliampere, let go effect. 20 milliampere, tetanic spasm or tetanic contraction. 50 milliampere, paralysis of respiratory system or respiratory muscles. 100 milliampere, ventricular fib. This is the easy way to remember this. More or less, it is approximate to this given value in the book. So we have seen the current strength. Then another one important thing is resistance. This current always flows in our human body in the direction or tissue which produces least resistance. Okay, so the amount of heat produced in a body is directly proportional to resistance. Say for example, if the resistance of a particular human tissue, that is skin, is more, then the damage will be more. If resistance of a human tissue is less, then damage will be less. In our human body, dry skin is the tissue with maximum resistance. After that comes bone. If the dry skin becomes wet, the resistance will reduce. Okay, in your MCQ, they may ask which is the tissue with maximum resistance. That is dry skin, not the wet skin. Then bone. Then another one MCQ. If they ask about the maximum resistance, automatically they may ask the tissue with least resistance. That is body fluid. Then blood comes. Okay, these are the things to remember. Another one is duration. If the current flows for more duration, then the injury will be more. Then type of current. Here, the thing to remember is there are two types of current. One is AC and DC. AC current means it changes its direction often in a particular cycle at a particular frequency. That is AC current. DC current means it flows in a single direction. If the current flows in a single direction, there is a possibility that the individual may be thrown off. But when a current changes its directions, it immediately produces tetanic contractions. So the person cannot be thrown off. It will lead to continuous contact with the electric wire and continuous flow of electricity. So AC current is more dangerous than DC current. Another one important thing is surface area. If the surface area is more, that is the contact with the electricity, the surface area is more, then the injury will be more. Another one important thing here to note is pathway. There are some pathways by which current flow in our human body. Current always take the shortest pathway and with least resistance. This is the protocol or dictum how the current will flow in a human body. The current always take the shortest pathway with least resistance. See this diagram. Here the current flows from right hand to left hand. Here left hand to head. Sorry, right hand to head. Here the current right hand to right leg. Here the current flows from left hand to left leg. While in this pathway, the important organs are heart. Another one is here in this pathway, one is heart. It goes through head. Here important center is respiratory center in the brainstem. Whenever the current flows through this important vital centers, one is heart and brainstem, it causes death. So among these, the shortest pathway may be differ, but the lethal pathway is right hand to left foot. This is the most dangerous pathway. Right hand to left foot. I draw here. Right hand to left foot. The reason is this is the longest pathway. Longest pathway means it takes more time to travel and it must or always transfers through heart. So the dangerous pathway is right hand to left foot. This is about pathway. Apart from this, some pre-existing disease in the individual, difference in the age factor may also play some role in the severity of injury. Then coming into the cause of death. In the clinical features itself, I have said it causes damage to all the system, particularly three important systems are there. One is cardiac, respiratory, and CNS. This is the system which causes death in electricity due to electrocutions. In cardiac injuries, it causes arrhythmia. There are two different things here. AC current mostly cause VFib, ventricular fibrillation. DC current mostly cause asystole. These are the reasons for cause of death due to cardiac lesions. Another one is respiratory muscle paralysis. Sometimes current flow in our thoracic cavity. It produces spasm of respiratory muscles or tetanic contraction of respiratory muscles. It causes asphyxia and death. In CNS, that means if the current flows through brainstem, important structure in brainstem is respiratory center. It damages the respiratory center and affects the respiratory center. It causes respiratory arrest and death. These are important causes for a cause of death in electrocution. One is arrhythmia, another one is respiratory muscle paralysis, another one is respiratory arrest because of damage of the respiratory center in the brainstem. Apart from these, there are some causes or secondary causes. The person may not died of electrocution, but he may be thrown off for some distance, or he may be fall from height due to this electric shock. That time he will get secondary injuries, blunt injuries to the body, either spinal cord or head injury. It leads to death. This blunt trauma are accidents and secondary causes. Some late causes are there present in these electrocutions. This electric current usually produces heat. Heat always causes dehydration. So person should have died of dehydration. This is important. Another thing is this damages the muscle. Damage to the muscle causes rhabdomyolysis. Rhabdomyolysis leads to acute kidney injury. Acute kidney injury causes death. This is one more important cause. Another cause is infection of the surface wounds, that is joule burns. So while treatment, we have to consider all these causes and prevent this. So coming to the treatment, one is in the scene of incident or accident, another one is in the hospital. In the scene of accident, the first important point is safety of the rescuer. We have to be very precautionary. We have to take precautionary steps while entering the field. We have to make sure that the current is cut off or not. We have to enter the scene with the preventable equipment such as wooden materials or rubber boots, like that we have to enter. The point here I want to highlight is suspended animations. Most of the persons who are electrocuted may be in suspended animation state. Suspended animation means nothing but a death-like state with life, but without vitals. While we examine, the person may be without any vitals, pulse, BP, breathing movements, like that. But there may be lives. That is one of the classical cases where we get this suspended animation is electrocutions. So to overcome this, we have to prolong the CPR here. That is the take-home message. In electrocuted cases, we have to prolong the CPR. That is the one point. And another thing is, in the hospital, we have to maintain ABC, airway, breathing, circulations, and we have to treat symptomatically. What are the symptoms? They say we have to treat accordingly. But the thing here I want to highlight is we have to admit the patient. Always try to admit the patient who are coming with a history of electrocutions, because in externally there won't be any injury, or there may be simple injuries, or just a crater, or just a 1 × 1 centimeter crater, like that. But we don't know what are the effects or severity of injuries within the body. So he may go to rhabdomyolysis and AK within a day. So always we have to admit the patient with the history of electrocution. That is the one point. Another one is IV fluids administration. In the case of electrocution, IV fluids administration is very, very important, even though vitals are stable. The reason is we have to prevent dehydration due to heat effect. Another one is well hydration will prevent rhabdomyolysis and further AKI. These important things I want to highlight. The person mostly be in suspended animation, so we have to prolong the CPR. That is the one thing. Another one is always try to admit the patient. Third one is give enormous IV fluids without going into pulmonary edema. These are the things we have to note in the treatment option. Another one is postmortem changes. In postmortem changes, if the cause of death is due to cardiac cause, that is because of arrhythmia, the individual will be pale. This is cardiac cause. If it is due to respiratory cause, respiratory arrest, either because of respiratory muscle paralysis or brainstem dysfunction, the individual will be cyanosed. In rigor mortis, in electrocuted case, rigor mortis will appear yearly. All the internal organs will be congested. Petechial hemorrhages will be seen in visceral organs and along the pathway of the current. If the current flows from right hand to left hand, then we can sometimes appreciate these particular hemorrhages along the pathway of the current. Another one is muscles and tendon. In muscles and tendon, we may see Zenker's degeneration. And particular hemorrhages in bones. In bones, electricity may produce fractures, either frank fractures or micro fractures. Another one important thing in bone is bone pulse. I will explain in the next slide. In the heart, the heart will be soft. Sometimes particular hemorrhages we can appreciate. The important thing here to note is in heart, most of the time electricity will produce roundening of the myocytes. This is the important point to note, roundening of myocytes. It's a HPE finding. In the blood vessels, intima is usually protected because of cooling effect of the blood. Usually, not always. In media, we can see tears or hemorrhage, which leads to thrombosis. Sometimes this thrombosis may cause death. We can add this cause of death also. Then in bones, I have said it produces bone pulse. Here we have to understand between these bone pulse and current pulse. There are two entities. One is bone pulse, another one is current pulse. This bone pulse, waxy pulse, candle vaccine, arterial spur. These four are same term. That is, current is flowing through our tissue and into the bone. In the bone, heat is generated. That heat will melts the calcium phosphate of the bone. See, this is the melted calcium phosphate. This melted calcium phosphate, this appearance is called as bone pulse or waxy pulse or candle vaccine and arterial spur. Another thing is current pulse. Current pulse is nothing but what is electricity? Electricity is movement of electrons from one electrode to another electrode. Likewise, when I touch a live wire, current will flow from the live wire to our body. In our body, along with the electrons, some metals of that particular conductor may impinge deep into our tissue. That is known as current pulse. These are metallic ions from the conductor which are deposited deep in the tissue along with the movement of electrons. That is known as current pulse. Current is current. So, metallic ions deposited deep in the tissue. That is current pulse. Bone pulse means dissolve of liquefaction of calcium phosphate. That is bone pulse. Clear? Then another important two aspects we have to know in electrocution is one is HPE, another one is metallization and Acro reaction test. In HPE of skin tissue, where we'll get Joule's burn, there are certain features. The electricity produces heat. Heat causes coagulation necrosis. That is the important thing. Another one is dermoepidermal separation in the skin. Sometimes that dermis will get separated from the epidermis due to the liquefaction of tissue. This liquefaction sometimes produces, this is the skin under microscope, liquefaction produces hollow-like appearance. This formation known as microblister. This appearance more or less appears cheese. So this is known as cheese pattern. These are the some terms they will say in the histopathology examination of electric injury or electrocuted skin. Then another one important thing is flattening of nuclei and palisading appearance. Usually nucleus will be round like this, but due to electrocution or electricity, passage of electricity, this nuclei will get elongated. See, this is the elongated nuclei, and it will appear in parallel rows perpendicular to the dermis. So this appearance is known as palisading appearance. These are the microscopic features we have to remember. One is it causes coagulation necrosis. Another one is it causes dermoepidermal separation. Third one is it forms microblister and fistich pattern. Fourth one is palisading appearance due to the flattening of nuclei. These are the important things in histopathological examination. Then the term metallization defines or signifies that the movements of metals from electrode into the skin. That is metallization. That process is known as metallization. This is human skin, electrons with the live conductor. So this conductor metals, say for copper wire means copper. This copper will be deposited in the skin. So this deposition of metallic ions from the conductor into the skin is known as metallization. The test to detect the metallization is acroreaction test. Acroreaction test is a microchemical test to detect the metal at the site of entrance of electric current. This is acroreactions. So we have to remember what is metallization and
சார் கேக்குதுங்களா? Sir, can you hear me?
sir.
Sir, can you hear me?
Now I can hear, sir. Hello. Hello. Hello.
சார் கேக்குதுங்களா சார்?
எனக்கு கேக்குது சார். உங்களுக்கு சார்?
கேக்குது சார். நீங்க ஷேர் பண்ணிக்கணுமா ஸ்கிரீன்?
இருங்க சார். ஸ்கிரீன் இப்ப தெரியுதா சார்?
தெரியுது சார். நீங்க ஸ்கிரீன் ஷேர் பண்ணிட்டு கிளாஸ்
ஓகே சார். சாரி சார், அது மழையில கட்டாய் வருது சார் கரண்ட். ஓகே சார். கேன் ஐ கண்டினியூ சார்? Okay. The difference between antemortem and postmortem electric wound by Jules Verne, we can't differentiate. That means Jules Verne will be positive in AM wound, even in postmortem electrocutions. Another one is histopathology examination. The findings in the histopathological examination will be present only in antemortem wound. It will not be present in
screen share agala sir.
Yes sir, sorry sir. இப்போ சார் ஷேர் ஆகுது Sorry, hello. Sorry guys, due to electricity or power failure, while taking electrical injuries, there is lot of disturbance due to electricity. Okay, the main difference between AM and PM we have to remember. That is, we can't differentiate between Joules burn. That is, Joules burn will be present in antemortem even in postmortem electrocuted cases. In HB, we can differentiate. Vital reaction will be present only in antemortem mode, not in postmortem mode. Then another one important thing is metallization. Metallization will be present both in antemortem mode and postmortem mode. These are the difference. Then important or recent advances to know in these differences: heat shock protein. The expression of heat shock protein will be seen only in antemortem electrical, not in postmortem electrical. So same wise, we have to know the difference between entry and exit. By appearance or Joules burn, both entry and exit looks more or less similar. So we can't differentiate with entry and exit. By appearance, we can say up to a certain level. Again, this metallization will be present only in entry wound, not in the exit wound. So vital reaction and HB findings will be seen both in entry wound and exit wound. These are the some peculiar points we have to remember. Coming to the last part, medico-legal aspects of electrocutions. These electric deaths or electrocutions are mostly due to accidentals while working in the household appliance or in the commercial purpose. Those who are working with electricity, they are more prone to get electrocuted. There are some cases reported who are electrocuted by self-intentional plan of suicide. Another thing here to note is autoerotic suicide or autoerotic electrocution. Autoelectric electrocution is a type of paraphilias where the individuals get sexual pleasure with passage of minimal electricity, minimal voltage, low voltage current. They usually get a wire and they will pass that low voltage electric current either through the genitalia or sometimes with the breast. That numbness and tingling will produce a sense of gratifications. During that process, they may accidentally die. This is one aspect. Yes, some homicidal deaths also reported. In a homicidal death, they will bring some electric coil over the forehead, or while working, they may get accidentally, like that they will plan. This is a type of homicidal. But the thing here to note is, in children or child abuse cases, we have to look for electrical marks in oral cavity, anus and axilla. Another next one is judicial electrocution. It's a method of capital punishment, usually executed in some states of US. Here they will place a wooden chair and they will make the convicted person to sit on the wooden chair. They will shave the scalp and place the electrode over the scalp, another one electrode in the either right or left arm. Usually they will place in the right arm, they will pass the electricity and get electrocuted. Judicial electrocution is a type of capital punishment. Then important thing is, in medical practice, in what are the conditions we are using electrical current. Important thing is defibrillator. Another one is diathermy, DCT. ECT, electroconvulsive therapy. These are some areas where we medicos use the electricity. We have to be careful. If the patients get some electrical injury because of either equipment failure or our unawareness, it amounts to medical negligence. These are some of the important aspects of the electricity. Then our last part, summary of this class is we have to know the definitions for electrical injury and electrocutions, the difference and mechanism. In mechanism, one is cellular depolarization, another one is production of heat. Factors affecting two law, V is equal to IR, Ohm's law, and Q is equal to I square RT. These are the things. Apart from this, pathway of current, part in which it's executed, or surface area like this. In clinical features, start from the tingling and numbness, it can lead to death. In PM appearance, most of the injuries. From skin lesions, we have to write skin lesions, that exogenous and endogenous burn, in Jules burn, crater, other types. After that, in skeletal muscles, Jenkins degenerations. In cardiac, that rounding of cells and soft and flabbiness of cardiac muscle, or dilated heart chambers, like that. In heart, like that we have to write. In cause of death, important one is cardiac arrhythmias, ventricular fibrillation, AS systole. In AC current and DC current. Another one cause is respiratory muscle paralysis and respiratory sphincter paralysis. That is the brainstem dysfunction. In the treatment aspect, important thing is prolonged CPR, admission, and IV fluids. The difference between exogenous and endogenous burns. That means a mode of mechanism. Here it is with contact. Here without contact. In endogenous, heat is produced inside the body. Here heat is produced outside the body. Then HP, that 3 to 4 points. Acro reaction and metallization, difference and meaning. Then medical legal aspects. That's all about electrical injuries. If there are any doubt or queries, you can contact this mobile or mail, or contact Medusane team. Thank you.
Thank you, sir. Thank you so much. It was really a wonderful session where you have just summarized all the key points that are necessary from the exam perspective. I think students, you have to go through the session very well if you have got cut in the middle. So I will also cut that intermediate part. We will just trim it down so that you can watch it without any disturbances in future. So as you all know, today there is a huge cyclonic disruption where we couldn't able to get power fluctuations are there and technical difficulty are there. So kindly excuse because for that. And the session was very, very good, which is useful for you to frame a essay or a short note asked, if at all it's asked in your exam, and such a one important topic this is. So I hope you guys enjoyed the session. We will get to you back after next wonderful session, which will be announced in the group soon. Thank you so much, sir, and
Thank
it's
you.
really
Thank you.
an honor for us to have you here, and we hope that we will continue the journey with us for many more
Sure,
classes in future.
Sure,
Thank you,
sir.
sir.
Thank you. Thank you, sir. Thank you.
Thank you, sir. Live end
Thank you.
பண்ணிட்டேன். So அது நான் no